Welcome to the lesson Critical Thinking and Clinical Judgment. After completion of this lesson, you will be able to describe the importance of critical thinking in today's society and in registered nursing practice, describe the role of clinical judgment in the profession of nursing, compose a definition of critical thinking, describe the importance of critical thinking abilities, dispositions, and judgment, and describe the role of critical thinking in the nursing process. What is critical thinking? When is thinking critical rather than just thinking? Why is there such a need for critical thinking in today's world? Recall a time in your nursing experience when you were able to solve a problem or answer a question or work through a situation for which you had no prior knowledge of the information. How were you able to do this? What thinking tools had you learned that you were able to modify or adapt to use in this new situation? How did your own values and ethics guide your analysis? According to Elder and Paul in 2003, the spirit of critical thinking involves critical thinkers having confidence in their ability to figure out the logic of anything they choose. They continually look for order, system, and interrelationships. What about you? Can you think of a time or situation which you were involved in where either something the instructor said or a situation when something happened that caused you to see things differently? Failure to develop critical thinking skills hinder lifelong learning. There are many factors that contribute to the importance of critical thinking. Some of these factors are healthcare reform, challenges related to changes in healthcare and nursing practice, changes in technology, role evolving from task-oriented to role-oriented, a major element of nursing school curricula, and identified as core competency to practice registered nursing. RNs need critical thinking skills to make wise decisions and collaborate on changes creating a positive impact in the future of nursing. Critical thinking as a concept has a rich history. It has been defined a number of ways throughout the historical timeline and has continued to evolve over time. In the early 1900s, critical thinking was considered reflective thinking. As it ventured on into the 80s, it was defined as thinking about thinking. During the critical thinking defining process, attempts were made to place critical thinking into steps or list of components, and at one point in the 1960s, the thought process was to go your own way or do your own thing, which led to the neglect of critical thinking. Current literature explores relationships among the concepts of problem solving, reasoning, critical thinking, creative thinking, metacognition, and how we teach these. Scriven and Paul in 2007 defined critical thinking as the intellectually disciplined process of actively and skillfully conceptualizing, applying, analyzing, synthesizing, and/or evaluating information gathered from or generated by observation, experience, reflection, reasoning, or communication as a guide to belief and action. They identified that this definition was based on clarity, accuracy, precision, consistency, relevance, sound evidence, good reasons, depth, breadth, and fairness. The cognitive skills used in critical thinking are interpretation, analysis, evaluation, inference, explanation, and self-regulation. Each skill is defined and identifies the application to the nursing process. Please review this table. You don't think you're biased. What about that 28-year-old that repeatedly comes to the ER complaining of back pain? You automatically assume he or she is a drug seeker. What about the poverty-stricken parents that can't afford supplies for their baby, and it's your job to find resources and supplies to assist them? Do you not think they are bad parents, but in reality, they are actually very good parents? There are challenges we overcome when developing critical thinking skills. As you transition from the LPN to the ASN role, you must identify your own personal feelings and beliefs and distinguish fact from opinion. Although there is controversy regarding the relationship between critical thinking and creative thinking, there is an agreement that the two work synergistically to produce good thinkers. After reading and thinking about the nature of critical thinking, you now have a greater understanding of the concept of critical thinking and the importance of critical thinking in nursing. You're probably asking yourself, does the ASN educational program differ from your prior education at the LPN level? The ASN level of critical thinking utilizes the higher order of thinking skills of analysis, synthesis, and evaluation in 4 different modes. These modes are problem solving, reasoning and informal logic, reflecting challenging beliefs and imagining alternatives, and metacognition and self-regulation. Problem solving as a mode of critical thinking has received a great deal of attention throughout the years in the areas of science. It is distributed into a 4-stage approach: understand problem, devise plan, carry out plan, and look back. It then developed into a nursing problem solving method such as assessment, analysis, planning, implementation, and evaluation. It is used by 98% of schools and effective in promoting critical thinking skills in students. Reasoning and informal logic as a mode for critical thinking has also received a great deal of attention. Authors often equate critical thinking with reasoning and informal logic. Bandman in 1988 identified the purpose of critical thinking in nursing is to identify and strengthen the critical thinking skills of nurses by demonstrating the role of scientific reasoning, logic, and philosophy in increasing the effectiveness of the nursing process and everyday nursing decisions. Glassman, Koff, and Spires in 1984 identify critical thinking as the ability to identify and formulate problems, as well as the ability to propose and evaluate ways to solve them, the ability to recognize and use inductive and deductive reasoning and to recognize fallacies in reasonings, the ability to draw reasonable conclusions from information found in various sources such as written, spoken, tables, graphs, and to defend one's conclusions rationally, and the ability to distinguish between fact and opinion. There are limitations to using the modes of problem solving and the mode reasoning in informal logic. That's why one must also use the mode reflecting, challenging beliefs, and imagining alternatives. The elements that are included in this mode are reflecting on assumptions, 9 critical thinking themes, critical thinking is not a passive process, must use reflection and intuitive listening, and then there are 4 critical thinking approaches that can be used by nurses. The 4th mode of critical thinking is metacognition, thinking about thinking. It is a self-regulated reflective practice, and one must be aware of your own biases and do not allow them to interfere with your clinical judgment. Many teaching strategies have been developed in the past few decades to foster critical thinking in students. Some of these techniques can include, but are not limited to, group work, noting patterns, building outlines or models, bringing dissimilar ideas or opposing views together, modeling, mind mapping or concept mapping, case studies, position papers, or computerized instructive scenarios. If it's been quite some time since you have been in school, you might find the classroom setting is quite different, especially in the hybrid program. The online learning environment is not the same as the traditional on-site classroom. Your learning environment for course content will be created by you, the student, as you progress through this program. The clinical environment will be created by the instructor. There may be times that you may feel uncomfortable that the instructor is not telling you what to memorize, but instead is leaving you to that role. The ASN program requires students to apply concepts. You're going to be required to play an active role in your learning process. The completion of this lesson has provided you with the knowledge of Course Objective 1. Describe the adaptive responses needed for successful transition from LPN to ASN knowledge base. Graduate competencies addressed are 3, 5, 6, 8, and 9. 3. Incorporate knowledge from the sciences, technology, and humanities into providing nursing care to promote health care for the client along the wellness-illness continuum. 5. Engage in the practice of professional nursing within the legal, ethical, and regulatory frameworks. 6. Demonstrate critical thinking and clinical decision-making through the use of the nursing process and research from nursing and related disciplines. 8. Utilize principles of management and leadership in diverse settings. 9. Assume responsibility for lifelong learning, personal and professional growth. This concludes this lesson. If you have any questions related to the content of this lesson, please contact the instructor.